Aarushi and Edna from Rhodes Park School. They are grade 12 pupils and members of the Daisy Care Health Club at Rhodes Park School. Over to you, Edna and Aarushi.
Forget about the things they can't do and focus on what they can. Everyone is much more than a diagnosis written on paper. Good afternoon, ladies and gentlemen. My name is Edna Mbewe, and I am here with my colleague, Aarushi Bashishta. We are esteemed members of the Daisy Care Health Club at Rhodes Park School and members of TOF Blue. Today we'll be presenting on the topic Autism Spectrum Disorder. But before I get into my presentation, I'd like to thank our supervisor, Musole Kanguya, and the executive Daisy Care Zambia for giving us this platform. Furthermore, I'd like to thank you, ladies and gentlemen, for sparing some time from your busy schedule for this presentation. During this presentation, we'll be covering the following, starting with the definition of autism spectrum disorder up until the reference. I greatly hope that you enjoy and learn as we move forth. What is autism spectrum disorder? According to the World Health Organization, autism spectrum disorder, ASD, refers to a range of conditions characterized by some degree of impaired social behavior, communication and language, and a narrow range of interests and activities that are both unique to the individual and are carried out repetitively. In other words, this means that autistic people have difficulties communicating and maintaining relationships. They tend to have repetitive behavior and they have restricted interests and activities. ASDs begin in childhood and tend to persist into adolescence and adulthood. In most cases, the conditions are apparent during the first 5 years of life. So now the big question here, ladies and gentlemen, is how did autism come about and who coined it? The term autism was first used by psychiatrist Eugen Bleuler in 1908. He used it to describe a schizophrenic patient, who had withdrawn into his own world. However, even though Bleuler coined the term, the pioneers in research into autism were Hans Asperger and Leo Kanner, who around the 1940s separately worked and had studied a group of children. It was from their work that they both discovered that the children they were studying had difficulties in social interactions, adapting to changes in routines, and had good memory. The only difference was that the children that Kanner studied had echolalia, meaning that they would repeat or imitate spoken words, while Asperger's children spoke like grown-ups. Moreover, it was through Kanner's observation that the term refrigerator mother came about. This was a theory that autism is caused by a lack of maternal warmth, which led to mothers being blamed for their children's atypical behavior. Even if early studies started in the 1940s, knowledge about autism and awareness were taken in by the public by the 1980s. In the 80s and 90s, legislation was passed giving autistic people and families with autistic children more resources and educational materials that would help. With more awareness, more parents, pediatricians, and more educators learned to learn the features of autism. As a result, more individuals were diagnosed. Now, based on recent research and data from the World Health Organization, the prevalence of autism spectrum disorder is 1 in 160 children. I'd like to inform you, ladies and gentlemen, that this is just an average figure as prevalence varies substantially across studies. So what is the prevalence of autism in Zambia? Unfortunately, this is not known as the prevalence of ASD in many low and middle income countries is so far unknown. Nevertheless, studies of ASD have reported that it occurs 4 to 5 times more often in males than females. Reasons for this has not been answered yet, as researchers and educators are yet to figure this out. Ladies and gentlemen, I would like to emphasize that autism is a spectrum of disorders. The severity of symptoms and signs between children will differ, and due to this, a scale is used to diagnose and classify people with autism into specific groups according to their signs and symptoms. This was introduced in 2013 through a revised edition manual called Diagnostic and Statistical Manual for Mental Disorders, 5th edition, which my colleague will go into detail. This is where the levels of autism come in. There are 3 levels, the last level being the most severe. Level 1, requiring support. In this level, a child is able to speak in full sentences. They function, but however, have small issues with back and forth conversations and have difficulty switching between activities. This is basically a high functioning level. Then there's level 2, requiring substantial support. In this level, the child has limited social interaction and has frequent, restricted, or repetitive behavior. And finally, level 3, requiring very substantial support. In this level, the child may say very few words and will have no verbal or non-verbal skills and will be extremely resistant to change in their routine. Now, what are the causes of autism? Just like autism has a range of spectrum of disorders, there are different risk factors, but however, no clear or definite causes. For now, I'd like to focus on the genetic factors, which we can readily define and understand the biology. The first one being the increased age of the father at the time of conception. The most prominent hypothesis of this is that the sperm of older men has accumulated many spontaneous mutations that they pass along to their children. Another way we can look at the genetic factors is by the concordance rate, which is the likelihood that if one sibling has the disorder, others will as well. Here we'll be looking at 3 types of siblings: identical twins, fraternal twins, and siblings that are not twins. First, we have identical twins who share 100% of their genetic information and intrauterine environment. The probability of one sibling having autism because the other one has it is 77%. Second, we have fraternal twins who share 50% of their genetic information and as well as their intrauterine environment. This set of twins have the probability of 31%. Finally, for siblings that are not twins but share 50% of their genetic information and do not share their intrauterine environment, will have a probability of 20%. Now, note that this is not giving us 100%, so genetics are really not the only risks of autism. There are a bunch of other factors caused by the environment which may trigger the disorder, some of which could happen when the mother is pregnant. During that period when the fetal is developing, exposure to certain agents can actually increase the risk of autism. In particular, valproic acid, a medication taken by mothers who suffer from epilepsy, can increase the risk of autism. However, folic acid supplementation may reduce the risks of ASD. Before ending my part of the presentation, I'd like to point out that there has been one factor that has been proven to be the cause or part of a risk of autism, which is the statement that vaccines cause autism. Ladies and gentlemen, vaccines do not cause autism, as the study that had suggested that was completely fraudulent. With that being said, I'd now like to hand it over to my colleague, Aarushi, who will continue the rest of the presentation from him.
Good afternoon. My name is Aarushi, and I will be taking over from my colleague Edna. The signs and symptoms of ASD. Social communication and interaction. People with ASD resist cuddling or holding and seem to prefer playing alone or being alone. They can't start or keep a conversation going on. They speak with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech. They don't express their emotion or feelings and appear to be unaware of others' feelings. They have poor eye contact and lack facial expressions. repetitive pattern of behavior, activity, or interest. They start saying or talking about the same things over and over again. Repetitive rocking, flicking, pacing, and headbanging. Many people with autism feel anxious when asked to change their routine or schedule. ASD signs and symptoms are usually seen in the second year of a child's life. They may be seen earlier if the child has several developmental delays or later as they become more mobile and social. Challenges. People with ASD are often subjected to stigma and discrimination, including unjust deprivation of healthcare, education, and opportunities. The people may be required to move from one school to another or on to college. Even if schools for autistic children are available, they are usually too expensive for parents that don't have the resources. Many may find challenges in finding a job or even keeping a job because most people with autism are uncomfortable changing their schedule or routine. They may find challenges in maintaining a friendship or relationship because of factors such as inability to express feelings and resisting physical affection as mentioned earlier. They may face bullying, exclusion, and prejudice. They may have challenges in traveling safely or independently. In order to battle these challenges in Zambia, a school for autistic kids called Proactive Ways Academy was opened in February 2017. It uses a special curriculum called Project Impact, which stands for Improving Parents as Communication Teachers, which is designed to show parents how they can help their children improve their communication skills. Diagnosis. Age of diagnosis is usually in the first 2 years of life. There are many different ways in which autism is diagnosed. Many professionals offer diagnosis based on varying assessment methods, ranging from simple interview to identifying symptoms required by the DSM to comprehensive evaluations such as the Autistic Diagnostic Observation Schedule, ADOS. This is an instrument which is used for diagnosing and assessing autism. It consists of a series of tasks which involve social interaction between the examiner and the person under assessment. ADOS comes in 4 modules, and each of them is designed to provide the most appropriate test for an individual at a certain age or functional level. Another method is the use of DSM-5. This stands for Diagnostic and Statistical Manual to Mental Disorders, 5th edition. This book is used as a diagnostic tool that defines and classifies mental disorders according to the severity of the signs and symptoms. Treatment. Behavioral management therapy. This is a type of therapy that tries to reinforce wanted behaviors and reduce unwanted behaviors. It also suggests what caregivers can do before, during, after, and between episodes of problematic behaviors. For example, a therapist may teach you to associate alcohol with an unpleasant memory, so you reduce or even stop the intake. Cognitive behavior therapy. This is a type of talking therapy that can help people to manage their problems by changing the way they notice and understand how their thoughts, behaviors, and emotions affect each other. Early intervention. This is a specialized support for children with disability early in life as soon as diagnosis. Educational and school-based therapies for autism. This is a therapy which is mainly aimed at the ages 5 to 18, which is mainly delivered in an educational setting such as a school. For example, the TEACH program, which stands for Treatment and Education of Autistic and Communication-Related Handicapped Children. Joint attention therapy. This focuses on improving specific skills to shared attention. For example, when a group of autistic people are showing similar symptoms. Medicational therapy. This is the kind of therapy which targets comorbid conditions such as anxiety and depression, and problematic target symptoms such as irritability, repetitive behavior, and self-injurious behavior. For example, medication that's used is risperidone, which is approved for the treatment of irritability in ASD, as evidenced by self-injury and severe tantrum behavior. Nutritional therapy. This is using nutrition to approach autism. Certain foodstuffs such as vitamin B6, C, and magnesium is used to improve symptoms in autistic children. Parent-mediated therapy. This is the type of therapy where parents learn techniques from professionals and provide specific therapies to their own child. Physical therapy. This is the kind of therapy that helps children with ASD develop their gross motor skills and basic motor skills. So kids with ASD can play games, sports, and take part in PE with their peers. Social skills training. This consists of early intervention behavioral treatments which foster correct development. This idea uses a reward-motivated behavior to teach children with ASD about recognition and application of normal social skills. Speech-language therapy. This helps people with autism to improve their verbal, nonverbal, and social communication. Its goal is to help the person communicate in more useful and functional ways. Myths. Autism is an intellectual disability. No, autism is actually a developmental disability that can cause significant social communication and behavioral challenges, as my colleagues earlier stated. Children with autism aren't affectionate. Children with autism may be oversensitive to touch and mostly do not understand the purposes of affectionate acts such as hugging, but it does not mean that they're not affectionate. There is an autism epidemic. There is no epidemic, however, the numbers are likely changing due to improved diagnosis and services rather than an actual change in the number of autistic people. People with autism can't feel emotions. They can, but they simply have difficulty expressing them, therefore many people believe this myth. Everyone with autism is a savant. Savant syndrome is a condition when someone with a significant mental disability demonstrates certain abilities far in excess of average. Although most savant cases come from autism, there is no proof to show everyone with autism is a savant. People with autism don't want friends. People with autism do want friends, but they have a difficulty in maintaining and forming relationships, as stated earlier under challenges. Autism is a result of bad parenting. Autism is not a result of bad parenting, but in fact genetic factors. Ritualistic behaviors should be stopped. No, it should not be stopped because this behavior is basically following the same routine obsessively without any change. Therefore, if an autistic person withdraws from it, it will greatly affect him or her as it is difficult for them to change routine. Autistics don't have a sense of humor. In many instances, you can find many autistic people laughing, which indicates they have a sense of humor, but they just have problems showcasing it. Autistic individuals are dangerous. They might be harmful to themselves, but to society, these are as dangerous as any other person. These are the references my colleague and I used. In conclusion, autism doesn't have to define a person. People with autism are like anyone else and they define themselves through hard work and individuality. My colleague and I thank you for your precious time.
Thank you for that lovely presentation on autism spectrum disorder. It is a condition that is not conversed about, and I think it is something very important that each and every one of us must know. And thank you, Edna and Aarushi, for presenting it and for bringing up this topic for the Daisy Care Health Week 2020. At this juncture, I would just like to invite your supervisor, Musole, for her final remarks on the presentation.
Thank you, Vishal. Good afternoon to everyone. Thank you for joining us for today's session. And it is my hope that it was helpful and you will share on autism spectrum disorder with people around you and that they may be able to know about it. To Edna and Aarushi, well done. Good job for the hard work that you put in to come up with this presentation. I just would love to emphasize on points that have been mentioned already. For the refrigerator mother theory. So it was believed that autism was a product of mothers that were cold emotionally, distant, rejecting, sometimes abusive, and thus depriving babies of the chance to bond properly, the maternal lack of affection. But this theory is now discredited and disputed in some places. And on treatment, I'm sure you saw that there was a long list of treatment that can be given to an autistic individual. It is not that everything is given for one particular person. Individuals will present differently, and so therapy is tailored to individuals to target their symptoms. At this point, I would just love to say that autism spectrum disorder is a reality to people that live among us. It is therefore our responsibility to take keen interest in knowing about this condition and other developmental disorders, as well as mental health disorders, that we may be in a better position to understand, to love, care for, and provide the very much needed support to individuals living with these conditions. In so doing, we may reach zero stigma towards individuals living with developmental and or mental health disorders. Thank you once again and have a lovely afternoon.
Thank you so much for that, Musole, for highlighting some of the key points and as well as concluding on autism spectrum disorders and the importance of each and every one of us knowing about mental disorders so that we can reduce stigma. Ladies and gentlemen, today we have come to the end of the Daisy Care Health Week at Rhodes Park School. At 17 hours today, we will be having a short certificate presentation for those that have performed exceptionally during the week to recognize their efforts that they have put in during the course of the week and for helping us spread the health awareness messages through their presentations live on Facebook and on other social media platforms. Edna and Aarushi, once again, thank you for the lovely presentation. Ladies and gentlemen, we hope that you will be able to tune with us at 17 hours to just witness the appreciation by Daisy Care Zambia towards the members of the Daisy Care Health Club for the effort that they have put in during the course of this week. Thank you once again and take care.